you for joining us for today's podcast interview with one of our exciting Institute presenters for the AAMFT Institutes for Advanced Clinical Training. Today we're joined by Diane Yapko, who's presenting on Autism Spectrum Disorders, Making a Difference with Challenging Children. I'm so glad to be able to talk with you.
Well, thanks. I'm happy to speak with you.
Tell us a little bit about why this topic is important to you.
Well, I guess it became important because so many kids needed the help, and as a therapist, obviously that's why we're in these professions, is to help people. So given the need, and the need just got greater and greater over the years that I was servicing children, that it became incredibly important to me to be well-versed in how to go about doing that.
Yeah, that's sometimes how these topics happen. We see them in our practices or in our research or our teaching, and then it just catches us and we realize that's where we need to be, huh?
Absolutely.
How did you become such an expert in this area as you were hearing about it and realizing this need?
I would say it happened by accident more than anything else. I saw my first child with an autism spectrum disorder, and he was diagnosed autistic in 1980. And I wound up doing a really good job with him, and it turned into referrals that came from that point on from the family who I had worked with, the physicians who had referred the child, and before I knew it, my practice was filled with this population, and I kind of just got tossed into it entirely by accident, and am really, really happy that it happened that way. It wasn't something that was part of my original training, and I don't think it's part of a lot of people's training.
You know, in learning about this topic and the amazing work that you're doing here, you offer a description of different types of concerns that maybe people didn't piece together as being an autism spectrum disorder. Can you talk a little more about that?
Sure. We have these images, whether it's autism that we're talking about or any other diagnostic label, and I'm not one for really liking the labels, but regardless, when you're talking about a label, you oftentimes have an image of what that looks like. And so if you think of autism as one thing, let's say you think of it as the more severe form where somebody's in a corner banging and screaming and hitting their head and not speaking, then you're not going to see the child who walks in that's just a little bit odd, that doesn't quite fit the typical peer group that he's a part of, and even recognize that that child may be on the spectrum, and therefore you're not going to be able to look at those kinds of individuals with the needs they may have. You may give them another label or give them a different category to go into, and not recognize that a child that comes into a therapist with a behavior problem or being anxious or depressed really may have an underlying autism spectrum disorder, and without understanding that, your way of treating that individual child may not be as efficacious as it could be if you knew otherwise. Family therapists are in the best position to help children and families, and they are often in their own trainings not taught about autism spectrum disorders. They don't learn a lot about children with Asperger's or those that are pervasively developmentally delayed or other labels that might be out there, and yet they're in the best position to help families.
So tell me, what are you looking forward to the most about offering this institute?
Entirely the group. When you have an opportunity to work in this intensive that association offers, and I've been honored to do it twice before, I love getting to know the individuals. They each bring their own expertise, their own interesting population that they work with, and there's a wonderful dynamic that occurs when you get to spend 4 mornings together with the same group of people, getting to know each other, sharing experiences, sharing expertise, sharing stories, and practicing skills with each other. That it's great to get to meet new people.
And I'm excited about this too, and I'm sure that many of our members will be. Thank you so much, Diane, for joining us.
Thank you, Ruth. I'm looking forward to it as well.
If you're interested in learning more about the AAMFT Institutes for Advanced Clinical Training, be sure to check out all the information at www.aamft.org.